What is the difference between cosmetic eye surgery and medical or functional eye surgery? In this episode of OCuTALK, ophthalmologist Samual Baharestani explains modern eyelid surgery, the preparation and recovery process, and the benefits to his patients. Dr. Baharestani?
I want to talk to you.
Not now, later.
No, now.
Hello and welcome to OCuTALK. Today we will be discussing some wonderful topics with ophthalmologist Samual Baharestani. Doctor, thank you so much for joining us today.
Thank you for having me. I'm excited to talk about this opportunity with OcuSoft as well.
Well, we are also really excited to get started. Could you tell us a little bit about your background and your specialty?
Of course. So I'm a board-certified ophthalmologist with subspecialty fellowship training in oculofacial plastic surgery, which is cosmetic and reconstructive surgery of the eyelids and face. I've been in practice for over 10 years now on Long Island in New York, practicing at Site MD.
Wow, Long Island, huh? That sounds nice. So for our conversation today, based on your specialty, we were hoping we could talk a little bit about cosmetic eye surgery. What is considered cosmetic when it comes to surgeries for the eye?
Yeah, so cosmetic surgery around the eyes are a very big field as patients are really looking to rejuvenate the appearance around their eyes. Oculoplastic surgery, or also known as ophthalmic plastic surgery, is a special field of medicine that combines the microsurgery of ophthalmology with the cosmetic principles of plastic surgery to offer our patients the latest techniques and most modern results. For cosmetic surgery, patients are usually presenting with options to be able to look better, which differs from other procedures that we offer to our patients for procedures that are mainly done for patients to see better. And these procedures that are mainly cosmetic can be anything from removing excess sagging or drooping skin around the eyes, to removing fatty tissue, to doing Botox injections or filler injections around the eyelids to help rejuvenate those areas and give patients a more youthful appearance.
So that sounds really interesting. That covers quite a range of things. Could you walk us through what some of those procedures look like?
Of course. So the most common procedure that I do is something called blepharoplasty, which is a procedure that removes excess tissue around the eyelids. For the upper lids, that helps to remove extra skin and gives people a less heavy or less gruff appearance to their eyelids. It's a common outpatient surgery. Outpatient meaning the patients come in and go home on the same day, with a fairly short recovery period of about 1 to 2 weeks where the patients are a little bruised. We use stitches after that extra skin is removed, or if extra fat is removed at the same time. And those stitches are usually removed a week to 2 weeks after the procedure. Once those stitches are removed, patients go on to living their lives and returning to their normal activity.
So how commonplace is that procedure? Do you do a lot of those?
Blepharoplasty is by far the most common procedure that I do in my practice as an oculoplastic surgeon. And for some patients, it can be done for cosmetic reasons if we're just looking to improve the appearance of their eyelids, whether that's the upper eyelids or the lower eyelids. But for many patients, as they age, the excess skin and fat may get so droopy where it's actually interfering with their vision. And for those patients, we can actually offer these types of same or similar procedures that can be covered by insurance to help improve their ability to see and help the functioning of the eye as well.
So who makes an ideal candidate for these cosmetic eye surgeries? For blepharoplasties to start, I would love to know, but also for some of these other procedures that you mentioned.
Yeah, so the ideal patient who's coming in for blepharoplasty is someone who's looking to improve the appearance of their eyelids, especially if they're looking for a cosmetic blepharoplasty as well. We're looking for healthy patients who are otherwise medically optimized, meaning they're following with their doctor, receiving all the medications that they need to be in order to be healthy and good candidates for the procedure. At the same time, these patients should have no other active eye issues. And specifically, we're talking about either dry eyes or problems with their vision in terms of problems from the front or the back of the eye that may need further care by subspecialists within ophthalmology. So we're looking for healthy patients with healthy eyes who are looking to remove some excess skin from the eyelids to create a more youthful appearance to their eyelids. These are the patients who are going to have the best results from their procedures and also be able to see the best benefits once they're fully recovered.
So if your patient comes in and they do have dry eye conditions, what is your protocol for that?
Yeah, for certain patients who have dry eyes, they're not the ideal candidates for blepharoplasty. Although dry eye is a very common procedure, the overwhelming majority of patients as we get older will have some degree of dry eyes. For patients who are undergoing blepharoplasty, we want to make sure that those dry eye symptoms are very well controlled. But at the same time, we always do explain to our patients that temporary worsening of dry eye symptoms is common after blepharoplasty. Over-the-counter treatments or management by a general ophthalmologist at the same time during their recovery period is sometimes necessary for these patients to be able to get through that hurdle of the temporary worsening of their dry eye symptoms so they can have the best result and really feel comfortable as they're recovering from the procedure.
Oh, that makes perfect sense. Is there an age range where you tend to see more patients? Younger patients, older patients, what's more common as far as these procedures are concerned?
So for cosmetic eyelid surgery, it's becoming more and more common to have the procedure done at a younger age. As the procedure has become safer and we've become more innovative in the ways that we offer these surgeries to our patients, we're able to allow for younger, healthier patients who are more interested in the procedure to come in. With that being said, the age range of patients that I treat in my practice goes anywhere from patients in their 20s and 30s to patients in their 80s and 90s. And for the younger range, it's usually the procedures where we're removing excess skin from their eyelids is more being done for cosmetic reasons. As patients get older and the skin gets so droopy where it's affecting their vision and ability to see, those patients are mainly having more what we call functional surgery, improving their ability to see and go on with their daily lives.
That's very interesting. So outside of that particular instance, are there other cosmetic eye surgeries that are performed for medical reasons?
Well, when you think about cosmetic surgery versus medical surgery, those are two different sort of categories. Cosmetic surgery, like I mentioned earlier, is doing surgery to help patients look better versus medical surgeries that are more done for patients' eyesight or that help them see better. And there are all a whole slew of surgeries that we can offer to our patients for both cosmetic reasons and what we call functional or medical reasons. And it really depends on an individual consultation with the patient, discussing what I see in terms of their anatomy, what I can do to help them in terms of surgery, and what their goals are after they're fully recovered from the procedure.
That makes perfect sense, actually. You had mentioned a worsening of dry eye as being a potential risk of any of these procedures or a side effect that happens after the fact. Are there other risks associated with cosmetic eye surgeries, blepharoplasties, or anything that we've talked about today?
With any type of surgery, there are always risks that are involved, and each patient has their own individual set of risks when it comes to surgery. In general, when it comes to surgery, usually we'll discuss things like bleeding, infection, and we'll make sure that patients are medically optimized so they don't sort of have those sorts of complications after the procedure. For patients who are receiving surgery, usually they'll be on a short course of antibiotics to help prevent infection as they're recovering from the procedure itself. There are a whole slew of other potential risks from the procedure as well, and usually it's important to have an individualized consultation or discussion with the patient to be able to say which risks may be more common for a certain patient and less common for others. With that being said, eyelid surgery is generally a safe and well-tolerated procedure for most patients who are undergoing it.
So what is your post-surgical procedure? What do you tell your patients to do when they leave your office and go home? What's the standard protocol?
Yeah, so the hardest thing for patients after eyelid surgery is that they often, for the first couple of days, end up looking a little bit worse than they did right before they had the procedure, because it is an area that typically does bruise a lot. And that's sort of why we're very careful about doing surgeries in these patients who are on otherwise blood-thinning medications or supplements that may thin the blood. For patients who are bruised after surgery, we usually recommend using ice to the eyelids very often after the procedure. The ice helps to keep down some of the swelling and bruising. And for most patients, just really taking it easy, no strenuous exercise for those first few days, helps them to recover and helps the swelling to go down more quickly. For a lot of patients, we'll ask them to sleep elevated, either with an extra pillow behind their head or in a recliner. That helps some of the post-op swelling and bruising to drain more quickly right after surgery, so they have a smoother or more quick recovery as well.
Is there anything a patient can do prior to the procedure to help the results be more optimal or their recovery time to be shorter?
Yeah, there are a lot of things that patients can do to help prepare for surgery to make sure that they can have the best results possible. Number one, having a consultation with your primary doctor to make sure that you're medically optimized is very important. At the same time, stopping any blood thinning medications, things like aspirin or Coumadin, Xarelto, or anti-inflammatories like Motrin and Advil. If these can be safely stopped before surgery, it means that they'll have less bleeding during the procedure and less bruising after the procedure as they're recovering. At the same time, we want to maximize their eye health as well before the procedure. So for patients who do have dry eyes, we ask that they're regularly using their artificial tear eye drops, or if they're on prescription strength eye drops for their dry eyes, they're regularly using that as well. We usually ask our patients to sort of have a general eye exam at least a year or so, or within the last few months before they have eyelid surgery, just to make sure that their eyes are healthy and they can go through with the procedure safely.
So is this procedure, eyelid procedure specifically, but in general, that's sort of what we're talking about, is it a permanent solution, like you have the surgery and then you're good to go, or is it something that has to be tweaked over time? Is it long-term? You get the benefits for an extended period of time?
So that's a great question with how long the results of eyelid surgery will actually last. With any type of procedure or any type of cosmetic procedure, it doesn't really stop the aging process. It sort of just halts it or sets it back in time a little bit. As we get older, things like genetics and sun damage, those types of things will lead to further aging. And at the same time, we have to realize that the eyelids are connected to other parts of the face. For the upper eyelids, our eyelids are connected to our eyebrows. The eyebrows are connected to the forehead. And as we age, even if you've had eyelid surgery, if you haven't had surgery on your eyebrows or haven't had a procedure to lift your forehead, those things can start to droop. At the same time, if you've had eyelid surgery on your lower eyelids where puffiness may have been removed, certain patients will actually go on to receive either Botox injections to tighten the skin. Some patients will have laser resurfacing to get rid of aging changes or other sorts of damage of the skin itself, or chemical peels are a good option for that. And similarly, the way that the upper eyelids are connected to the eyebrows and forehead, the lower lid is connected to the rest of the face. So even after lower eyelid surgery, certain patients will go on to either have filler injections or even a facelift afterwards to maintain the results and give them the best results around their face.
That is really interesting. That makes sense. I mean, aging, there's nothing you can do about it, right? So if you have patients that come in for functional eye surgery, do they often come back in for cosmetic surgery after the fact then?
It's very common for patients to come in with a specific functional complaint, saying that they're having trouble seeing, or when they switch lanes when they're driving, they cannot see very well because their eyelids are blocking their vision. During a consultation, I usually will also not only describe ways to fix that functional complaint, but at the same time, we discuss cosmetic concerns that may bother a certain patient as well. Everybody's a little bit different. Some people only care about the function. They want to make sure their vision is good as possible, and they really just want to maximize that through functional eyelid surgery. Other patients are like, well, doc, while you're there, why don't you do at the same time, remove a little bit of puffiness or do a little bit of filler or Botox injections to fix some wrinkles around the eyes as well. That not only gives one recovery to the patient, but it also kind of addresses two problems at once, both their medical concerns, but also their functional concerns as well.
Well, thank you, doctor. That is really fascinating. That is definitely something I did not know about eyelid surgery. Before we wrap up today, is there anything else you would like to talk to our audience about?
Yeah, so oculoplastic surgery is what my passion is. I love treating patients who are interested in not only improving their vision, but also improving their looks as well. The field is really changing, and so is cosmetic surgery in and of itself. Our patients are coming in at a younger age asking for these cosmetic procedures just because there are more options available and there are safer options available as well. Individualized consultations are always necessary, so we're on the same page when it comes to planning a treatment or planning eyelid surgery. And then as an ophthalmologist specializing in eyelid surgery, I'm not only be able to assess the health of the eye, but also I'm able to offer my patients options for improving the cosmetic results around their eyes as well.
Well, doctor, thank you very much. This has been really informational. Why don't you tell our audience where they can find you?
Thank you so much for the opportunity to speak with you. So as an oculoplastic surgeon on Long Island, I work for SightMD, which is a large and growing practice, not only on Long Island, but in the Northeast. I'd be happy to see any of my patients who would be interested in a consultation for cosmetic or even functional surgery. I invite you to call our offices today.